We begin with a battle over benefits, especially for the people who need them the most. Continued government cuts coming down from Washington have thrust social programs like Medicaid into the spotlight. Some 72 million Americans rely on Medicaid to stay alive. It provides comprehensive and long-term care to folks who otherwise couldn't afford it. That doesn't even count millions more enrolled in Medicare or CHIP, the Children's Health Insurance Program. You add all that up, more than 40% of the U.S. population depends on these services, which is why you're seeing concerns swell across the country as the Department of Government Efficiency and Republicans on Capitol Hill weigh what they'll cut to satisfy the president's agenda and trim the federal budget.
For the first time, we are making some progress identifying places that we can reduce the budget, and this is something we have to do as a country.
Town halls have gotten pretty heated as lawmakers consider cuts to Medicaid. Earlier this month, the nonpartisan Congressional Budget Office said Congress can't meet its budget targets without making significant cuts. And all of this is happening as the push continues to expand benefits here at home.
Let's be honest. The only reason we haven't expanded Medicaid is partisan politics.
For a seventh time, Governor Laura Kelly called for Medicaid expansion in Kansas, and for a seventh time, Republicans shot it down. That's not stopping Kansas voters from demanding lawmakers protect Medicaid. They gathered in Topeka earlier this month, worried about what could happen to their loved ones if possible cuts leave them without coverage.
I don't know what would happen to her if Medicaid wasn't there to pay for the nurses that she needs every single day. What happens? I don't know. I mean, I'd have to quit my job and stay home and do that. And then if something went wrong, I mean, she'd likely die because I don't have the training necessary.
Kansas is one of 10 states that hasn't fully expanded Medicaid. Missouri voters approved Medicaid expansion in 2020. Let's get to the heart of the matter with April Holman, Executive Director for Alliance for a Healthy Kansas. Thank you so much for joining us today. You represent more than 130 organizations that all support Medicaid expansion, and now there's another factor here by way of potential government cuts. So what are you hearing from these groups?
So we have a really broad range of groups that are part of the Alliance. And so, we have some providers of healthcare who are really concerned about what that's going to mean for their financial viability long term. We have consumer groups and groups that represent specific diseases like the American Cancer Society, Cancer Action Network, or the American Heart Association that are worried about the consumers who have those illnesses. There is just a lot of uncertainty about what's going to happen with the Medicaid program. We know that there has been a large cut that's been identified, and at this part in the federal process, we don't know exactly what that's going to look like or what the specifics are going to be, but we know that that level of cut is going to mean that Kansans will lose their coverage.
And let's talk a bit about that, just the sheer scope of the number of people that are using Medicaid and Medicare for that matter. I mean, it's a huge number in Kansas and across the country.
Absolutely. So in Kansas, there are over 400,000 individuals who are receiving their health care through the Medicaid program. And quite honestly, we actually have fewer in Kansas than in Missouri and our other neighbors because we have not gone forward with Medicaid expansion. So we're one of 10 states that have held out on making that move that would actually help more people in our state get access to the affordable health care that they need. And it would at the same time help our providers who too often are having to provide care but not be reimbursed for that cost. So it puts our providers in Kansas at a disadvantage to their peers in Missouri and all of our neighboring states.
We talk about recipients. What's keeping you up at night right now? Who's most at risk here?
One of the things that we do at the Alliance is meet with individuals who have lived experience in the coverage gap, and we have started also meeting with people who have lived experience in receiving care through Medicaid. So I think of those people when I think about the risk that we are in at this point in time. So certainly when we're talking about the federal cuts, we're talking about people who are already receiving their care from Medicaid in Kansas. That would be seniors who are in nursing homes. That's a large part of the program. It would be children. So we know that over 42% of Kansas children receive their health coverage through Medicaid in one form or another. We also know that a large percentage of Kansas babies are born with Medicaid care. So I think about those vulnerable people who are really our youngest and some of our oldest and frailest, and the risk that this is going to put them in terms of being able to get the health care that they need.
We saw you at the rally just a moment ago from earlier this month. Were lawmakers at all receptive? Because as we said, Medicaid expansion, it looks like it's failing a seventh time.
I think it's really interesting. In Kansas, we've seen poll after poll show that the people of Kansas really want to see Medicaid expansion happen. And I would say that even some of the representatives at the State House who are unwilling to vote for it also know that it's something that needs to happen. But we've had a group of very powerful legislative leaders who've been able to keep this from moving forward through any kind of meaningful process at the State House. They've blocked hearings. They've made sure that health committees are stacked with individuals who oppose expansion, and they've been able to really shut down the conversation about it over the past several years in a way that disconnects the will of the people from what's happening in our State House. So I think what we wanted to see more than anything, and what happened at the rally, was there was more conversation publicly about Medicaid expansion and the reason that we need to do that in Kansas, but also about the risk that we're in at the federal level and what that would mean to people in Kansas today.
Well, it's a conversation we'll be watching closely. April Holman with Alliance for a Healthy Kansas, thank you so much.
Thank you.